Hi, my name is Christine Rayfield, and this is my head-to-toe assessment return skill demonstration for NR 304. I'm going to scan the room now. Okay, and this is my patient.
Richard Rayfield, and I give Chamberlain University the right to use this video for grading purposes.
Okay. Good afternoon, Richard. How are you doing?
Good.
Good. My name is Chrissy, and I'm going to be your nurse this afternoon. I'm here to do an assessment from your head to your toe, just to evaluate your body, and if we find anything abnormal, it just gives us a reason to look in for the cause of them. It should take about 15 to 20 minutes. Is now a good time to do that?
Yes.
All right, let me go close this door so we can have some privacy. Shut the door, and I'm going to perform hand hygiene. All right, let me take a look at your wristband, and I want you to say your name and your date of birth.
Richard Rayfield, August 24th, 91.
All right, perfect. Do you have any allergies that we need to be aware of?
No.
All right, and can you rate your level of pain from a 0 to a 10? 0 being no pain, 10 being the worst pain.
0.
All right, wonderful. So I'm going to start off with your general appearance. Your facial expression, your mood, and your speech is clear. Everything is appropriate for the situation. I don't see any signs of acute distress. And I'm going to assess your level of consciousness. So you told me your name, so that tells me you know who you are. Can you tell me where we are?
Living room.
Can you tell me what we're doing?
Head to toe assessment.
And can you tell me what today is?
Monday.
All right, so my patient is alert and oriented ×4 to person, place, time, and situation. All right, so we're going to move on to your skin. So I'm looking at the color. It is even and it is appropriate for your race. I'm looking for any lesions, incisions, wounds, scars. I do see some tattoos, but I don't see anything abnormal. The temperature is warm to touch. The skin, the nail color is pink, and the shape is flat. It's less than 160-degree angle. And the capillary refill is less than 2 seconds. Can I see your other hand? All right, wonderful. So we're gonna move on to your head, face, and neck. I'm gonna palpate your scalp. I'm looking for any infestations or lesions. I don't see or feel any. I'm gonna look at the symmetry of your face. So I'm looking at your eyebrows, and then I'm looking at your outer canthus of your eyes, and then your labial folds. Everything looks symmetrical. Can you smile for me? And can you frown? Okay, so his cranial nerve number 7, the facial nerve is intact. I'm gonna put some cotton on your face, and I'm gonna test your cranial nerve number 5, the trigeminal. Let me know when you feel this on your skin.
Yep. Yep. Mm-hmm.
Okay, so the cranial nerve number 5 sensory is intact, and then can I have you clench, grit your teeth? All right, good. So the motor and the sensory function for cranial nerve number 5, the trigeminal, is intact. I'm going to assess cranial nerve number 11 now, the spinal accessory. Can you lift your shoulders as I press down? Perfect. And look towards my hand. And again. All right, wonderful. So the spinal accessory cranial nerve number 11 is intact as well. All right, we're going to move on now to your eyes. Looking at your eyes, the sclera is white. Can you look up? The conjunctiva is pink and moist. I don't see any redness or discharge or drainage of the eyes. Pupil size is about 4 millimeters, which is in normal limits. And then I'm going to assess the pupils now. Look straight forward for me. Good. Very good. All right, so the pupils are equally round and reactive to the light. And the color of his iris is green. Okay, I'm gonna have you follow the tip of my pen. Okay, so his pupils are equally round, reactive to light and accommodation. All right, I'm gonna assess the cranial nerves number 3, 4, and 6 now. The oculomotor, the trochlear, and the abducens. So I'm gonna have you follow my light pen again. And this is the 6 cardinal fields of gaze. Okay, my patient was able to do that, so cranial numbers 3, 4, and 6 are intact. All right, I'm gonna move on now to your ears. I'm gonna palpate, and do you feel any tenderness when I'm doing this?
No.
Okay, I'm gonna inspect the external auditory meatus for drainage and discharge. I don't see any on this side. Let's look at the other side. Okay, no drainage or discharge on that side as well. And then I'm going to do what's called the whisper voice test. This is going to assess cranial nerve number 8, the vestibulocochlear or the acoustic nerve. So I'm gonna whisper something in both ears and I just want you to repeat what you hear.
How are you? What's for lunch?
All right, so the patient's cranial nerve number 8, the vestibulocochlear, is intact. So now we're gonna move on to your nose. I'm gonna look at the internal structures and look up. I'm looking for deformity, asymmetry, and inflammation, and I don't see any of that. I also don't see any drainage of the nose. Can I have you breathe in? You breathe in? All right, the patient has bilateral patency. And then I would also assess the olfactory nerve, cranial nerve number 1. I would give the patient something to smell and he would have to tell me what it is, like lemon or coffee, mint, cinnamon, something that's easily recognizable. And that would tell me if that nerve was intact or not. All right, we're gonna move on now to your mouth and your throat. So from visualizing, I see your lips are pink and moist. Can you open for me? Your tongue is pink and moist and your gums are pink and moist. And then at this time, I would assess the cranial nerves number 9 and number 10, the glossopharyngeal and the vagus nerves. And I would do that with a tongue depressor, making sure that the patient had a gag reflex. And then can I have you say ah? Okay, and when the patient says ah, his uvula and soft palate elevate. So that tells me that cranial nerve number 9 and 10 are intact, the glossopharyngeal and the vagus. So can you stick out your tongue now? All right, and so the patient can stick out his tongue and that tells me cranial nerve number 12, the hypoglossal nerve, is intact. All right, now we're gonna move on to your respiratory system. So just by taking a look at your breathing, I'm not seeing any accessory muscle use to breathe, so that is good. I'm gonna auscultate lung sounds and I would do this with bare skin. Can I have you stand up? And face the camera. Okay, starting on the upper right lobe. Can you breathe in? Upper left lobe, breathe in. Upper right lobe. Upper left lobe. Right middle lobe. Left upper lobe. Right middle lobe. Lower left lobe. Right lower lobe, left lower lobe. Okay, can you turn around and we'll do the posterior? Left upper lobe, right upper lobe, left upper lobe, right upper lobe, left upper lobe, right upper lobe, left lower lobe, right lower lobe, left lower lobe, and right lower lobe. All right, perfect. You can have a seat for me. So those were clear breath sounds. So then I'm gonna move on to your cardiovascular system. I'm gonna assess your pulses. So starting with the carotid pulse, I'm gonna palpate one at a time. All right, regular rate and rhythm 2+ bilaterally. I'm gonna do the radial pulse next. Regular rate and rhythm 2+ bilateral. I'm gonna do the dorsalis pedis. Regular rate and rhythm 2+ bilateral and the posterior tibialis. Regular rate and rhythm 2+ bilateral. So I'm also assessing for edema. So I'm looking at his feet right now. I'm not seeing any pitting edema, no swelling, and also none in his hands. So no edema is present. I'm gonna auscultate some of your heart sounds now. Again, I would do this on bare skin. I'm gonna start with the diaphragm and listen for the S1, S2 sounds. Starting with the aortic, which is second intercostal space to the right of the patient's sternum. S1, S2, lub-dub sounds are heard. Then I'm going to pulmonic, which is the second intercostal space left of the patient's sternum. S1, S2, lub dub. Erb's point is third intercostal space left of the sternum. Lub dub, S1, S2 sounds, and then tricuspid is fifth intercostal space left of the sternum. S1, S2 lub dub, and then the mitral is the fifth intercostal space mid-clavicular line. S1, S2 lub dub sounds. Now I'm going to listen to with my bell for murmurs. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, no murmurs were heard, so just S1, S2 sounds, no S4 or S3 or S4 sounds. Alright, good. Alright, so we assessed your cardiovascular system. Now we're going to move on to your gastrointestinal. I'm going to have you lay back, and I'm going to inspect the abdomen. Again, I would do this on bare skin. So I'm looking at the contour and the symmetry of his abdomen. So it's flat and it's symmetrical. I'm going to listen to bowel sounds starting in the right lower quadrant with my diaphragm. Alright, I hear active bowel sounds, upper right quadrant. And I hear bowel sounds, this is the upper left quadrant. I hear bowel sounds, and then lower left quadrant. Alright, and I hear bowel sounds there as well. Now I'm going to lightly palpate those areas. Let me know if you feel any tenderness. Any tenderness? Alright, no tenderness, no distension. That was the right lower. This is right upper quadrant. Any tenderness?
No.
Alright, no tenderness or distension. Left upper quadrant, any tenderness?
No.
No tenderness, no distension, and then lower left quadrant. Any tenderness?
No.
Alright, no tenderness or distension were found on the gastrointestinal system. So I'm going to have you sit up now, and then I'm going to assess your mucoskeletal system. So first thing I'm going to do is assess your gait. So I'm going to have you stand up for me first. Alright, and then I'm going to have you walk towards the camera, putting your heel to your toe. Walk straight forward. Okay, perfect. And then walk normal as you come back. Okay, and then can I have you stand with your feet together? Close your eyes. Alright, perfect. And now I'm going to have you touch your heel to the other shin. And the other one. Alright, good. So normal gait, good coordination. Can I have you sit down? I'm going to assess some of your joints and then your muscle strength too. So I'm going to start with their arms. I'm going to have you flex your arms, and then I'm going to try and pull them. I want you to resist me. Perfect. And then the opposite, push against me. All right. And then lift up your leg. Try to push it down. All right, now push it up. And same with this one. Try to push it down and push up. All right, good muscle strength. And then I'm gonna do the sensory function test. So I'm gonna have you feel a dull and then a sharp, and I want you to tell me the difference between each. So I'm just gonna show you what each feels like. So that would be sharp, this would be dull, okay? Can you close your eyes? What do you feel?
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp.
All right, perfect. I'm going to assess some of your joints now. I'm going to do 2 upper and 2 lower joints. So I'm going to start with your elbows, and I'm looking at the symmetry and the contour of your elbows. So they look symmetrical, they look the same, and I don't feel or see any deformities of the elbows. Can I have you flex your elbows and extend, and then pronation, supination. All right, Good. So full range of motion for the elbows. Let's look at your wrists now. I'm looking at contour and symmetry as well. They feel smooth, no deformities. They look symmetrical, same in size. Can I have you extend your wrists and flex them? Can I have you grasp onto my hands? Good. All right, full range of motion in the wrists as well. Let's look at your knees. I'm looking at the contour and symmetry right now. Everything looks even in size, no deformities. Can I have you stand up so that we can test your range of motion? Can I have you flex your knee, both of them, and then extend both of them? All right, perfect. Full range of motion in the knees. Have a seat and let's take a look at your ankles. Can you remove your shoes again? All right, looking at size and contour. They look symmetrical in size, even, no deformities. Can I have you flex your feet, point your feet? Can I have you tilt them inward, inversion, and eversion outward? All right, good. Full range of motion for the ankles, knees, wrists, and elbows. All righty. So you mentioned that your pain level was a 0 before. Is that still the case?
Yes.
All right, wonderful. Is there anything that I can get for you to make you more comfortable?
No.
All right, well, you have a call light within reach. If you do need anything, we'll come in and check on you. The wheels are locked, the bed is in the lowest position, and the side rails are up. Thank you for allowing me to do the assessment, Richard. If I don't hear from you through your call light, we'll come back to check on you shortly.
Okay.
All right, and then I'm going to perform hand hygiene as I leave the room.